Well, it's such a pleasure to be here with you, and I want to thank Tracy, Dr. Crane, and also, of course, Dr. Kalfa Carmen for putting this together and for making this possible. I'll also share that this is a very, very special presentation for me, not only because I understand it's being recorded and then it'll be projected tomorrow among physicians, so I'll try to mix between the advocacy and a little bit more of the science, but also if I tear up, it's because someone extremely dear to me and a key pillar in my cancer journey is here with me, who has, I don't think, ever heard me speak publicly, or certainly not for a very long time. Our daughter, Mariana Knaul, is here with her boyfriend, Herschel, and that's a very special and unexpected piece of joy for me. And you'll see that she figures so centrally in the story that I'm going to share with you, and I'm sure going forward as a UM student, she's going to figure so centrally in advocacy around cancer and the rights of those who suffer inequities around our world. She's quite remarkably good at that. So I'm going to share with you, title is Breast Cancer Closing Global Divides, but we're going to speak a little bit across different cancers, and I'll try to link it also to health systems innovations. The overall idea is that there's a duality between evidence and advocacy, that we are searching for that sweet spot between advocacy-inspired evidence and evidence-based advocacy. And when you get those two together is when you get the kind of action that we're searching for to close divides in cancer, to do better science, to do so much of what we search for in improving the health of our world. And that's better projects, programs, papers, and policies. But you need those two to unite together. And our personal experience and mine as a family has helped me to think about how to make that possible as both a scientist and a health system researcher and as a patient advocate. So my journey as a patient, our personal experience starts here. I had certainly worked with children in cancer around Mexico in particular. My father had passed of a stomach cancer years before, but I hadn't personally experienced cancer. This is a picture of me in June of 2007. I'm standing in front of a painting that was done by our older daughter, Hanna Sofia, and she was painting her Botticelli. And her Botticelli was her mother, and it was all about my hair, which looked a little different then, maybe not as much as it did in what you're going to see as we move forward from the presentation. But that was how she saw her mother. And only a very few months later, I was diagnosed with an invasive stage 2 breast cancer. There is Mariana. She was 3. Hannah was 11. There was no reason to assume that this would happen. It was my first baseline mammogram. There was no history of breast cancer in our family, and it was the last thing I expected when I went in for that mammogram in a small private clinic in Cuernavaca, Morelos, Mexico. I went through what most women about my age, I was 41 at the time, go through with an invasive, in my case, triple positive breast cancer, a long journey that was many surgeries and 16 rounds of chemotherapy and initially a unilateral mastectomy. The vast majority of our care was done by choice in Mexico City at one of our leading hospitals, Medica Sur. As some of you know and will see in a minute, I'm married to Julio Frank. He had just completed 6 years leading the Mexican health system, and we, as a couple, and me as a patient, made the choice that we wanted to be treated primarily in Mexico and show that in Mexico, within our health system, and for the millions and millions of women and other patients who could not leave the country, that there was hope of having access with financial protection to high-quality treatment. We lived it quite publicly and very deliberately in Mexico. That said, I had the great fortune of also being a patient of the Seattle Cancer Care Alliance. They helped lead the orchestra. There's me in front of their phenomenal glass hat exhibit. And My lead physician who led this orchestra is in the other room, and to whom I'm incredibly grateful, Dr. Julie Graylow. And so I was able to have really the best of all worlds in being able to go back and forth in this long and complex journey. And most recently, that culminated in a second mastectomy out of choice. But yes, based on need, I waited many, many years to decide that it was the right time and it was necessary to have that other mastectomy. Here at Sylvester, in our Lennar Medical Center, and that's one day after, that's the morning before, I guess somebody chose to make our green and orange ibises turn pink that morning at 6:30 a.m. And the very next day, thanks to the wonderful care I received, I was up and walking. But it has been a very long journey, as it is for most of us who live cancer. And whether or not we can say we have those cells still circulating or not in our bodies, it's a journey of survivorship that continues. We decided to also share our story as a family, because initially this was a very, very difficult process for me. And I didn't live it publicly, and I didn't take the notice, what we found, well at all. And I refused treatment for several months entirely, and particularly refused a mastectomy, refused chemotherapy, and there was a lot in this process. And there were many reasons why I went ahead, and one of them is over there. But these days were tough. And I remember, I'm sure she does, that I kept a baseball cap on. For any of you who have gone through this, your hair comes out in tufts, right? So I had a baseball cap on, and I was sure that she at age 3 wouldn't notice that there were tufts and there were holes in my hair, and she wouldn't figure it out. But she very schemishly decided to rip off that baseball cap. And in a second was hiding under the bed screaming that there was a bald vampire in her room who was me. And yet, we managed to get through it, and that's the wig stand that Mariana made into her bald princess instead of a bald vampire. I'll admit, as I do in the way we wrote up this, that was the only time I ever used one of the several wigs that we spent a tremendous amount of money purchasing. The only thing we ever used was the wig stand, but the wig stand came to very, very good use, and we still have it somewhere in our home with the holes, with the head, with the scarves, with the painting, with the makeup, with all that made this into a much friendlier way of going through what we had to go through as a family. And together, and it took us some time, but thanks to Mariana, I learned in so many ways to laugh at my baldness, and more importantly, she has always challenged me to challenge my cancer and to challenge the multiple issues that we face as a family that has had to go through cancer and so many other extreme difficulties in our lives. We decided once I was able to go through the treatment not to hide in the house, to be open, to be public, not to wear that wig, and I did it very deliberately. I did it and we did it because we wanted to show in Mexico, where cancer is so stigmatized still, where so many people who go through this disease can't hope to retain their jobs, can't hope to retain their families or their partners or their couples, that you can be a family, that you continue to work, that you can be outside, that you can and should be a productive member of society throughout your treatment. I learned along the way and grew from the support of my family. That's my brother, who until very recently, still a test pilot, but until very recently a leader in the Canadian military in search and rescue. He had done several tours of duty. And I gotta say, I never thought we looked alike until I lost all my hair. And suddenly I realized that he really is my brother, and he was there holding me so many times, which was so important. And as I shared with you, this was a journey that we did together as a family, but that Julio and I did very much together as a couple. Now, as I said, he had just stepped down from a full 6-year term with President Fox at the helm of the Mexican health system, a large health system that was serving over 100 million people. And he's a gifted researcher, a health systems researcher. We had worked on And we have, since then, many different studies of the Mexican health system and globally. But what we learned from our cancer journey is that it's one thing to lead a health system, it's another thing to learn about a health system, but it's very different to live a health system. No matter how many resources you have at your disposal, when you face a cancer diagnosis, you learn that there are obstacle after obstacle, complication after complication, and it's how we got to truly understand the ins and outs of a health system that we had been studying for so many decades. And it's changed the way that we do our research around Mexico, but also globally. This is the part where we'll switch to a little bit more of the research, but focused on what I've learned from patients. But I'll just share with you that we did publish 2 books, one in Spanish, Tómatelo a Pecho, and one in English, Beauty Without the Breast, about a decade ago. And that in those books, Julio's letters to me, love letters, while I was going through chemotherapy, he allowed me the gift of being able to publish those. And so even if you don't read the book, you might want to switch back just to read those letters, because they're rather unusual letters from the president of the University of Miami. But I had told you that I didn't face this cancer diagnosis with that kind of laughter, challenge, positively. And there was a point, though, at which I was refusing treatment. I couldn't figure out how to move forward. And it suddenly occurred to me that I was tremendously lucky compared to the millions of other patients that I had seen in our public hospitals. And that was because I had choice. I had the choice of being able to receive treatment. I had choice because I was able to find childcare, particularly for my small child at the time, but also for my 11-year-old, and support and help for them. And that challenged me to start the work that came out to be our NGO, but it started with these data. So somehow, during some of those infusions, I decided to do what I know how to do, which is to look over time at mortality data. And we saw that for Mexico, something that was very surprising to us that no one had realized was that the majority of women were facing breast cancer, not cervical cancer, as a cause of mortality. And that while cervical cancer had gone down tremendously by more than half, breast cancer was increasing. We got 2 messages. One was a very, very hopeful message about what you can do even in the poorest communities to fight cancer, as has been done for cervical cancer, and that we had a new challenge facing us that had truly been ignored, which are these more complex cancers that you can't vaccinate away, that you can't easily prevent, and that require a long and complex treatment. And from that, we started this small NGO, Cáncer de Mama Tómatelo a Pecho, which today works in a much broader way across the Mexican health system in Latin America, on health system strengthening, on all cancers, and also primarily on women's health. What I want to tell you in the rest of this journey is what I learned from the patients that I met along the way that helped me to understand how to work to strengthen through advocacy, through our NGO, and through collaborations and research, the work that we could do. So first, this is Juanita. She was probably the most important person that I could have met along the way. And she had a very advanced case of breast cancer, and I met her actually very near to where I was diagnosed. And I went in and mistakenly thought that Juanita was unilaterally mastectomized because one side under the sheet was so much larger than the other. And when I asked her, in my best Spanish, she had no idea what I was talking about, and we thought that, or I thought at the time that, well, it was just that she didn't understand the word mastectomy. It turns out that what I was seeing was a lump the size of a large orange or a small grapefruit. But Juanita was in her early 40s. She had 3 young children. We have an amazing primary healthcare system. She had been as a young mother and then as a mother on and on going through and seeing our primary healthcare leaders. And no one had diagnosed her breast cancer. No one had checked her because they assumed that a poor woman wouldn't get breast cancer. Juanita passed about 2 years later despite having access to treatment, and that was because our health system failed at the primary level of care. So what we decided to do with that information and the gift that Juanita gave us was to demonstrate that you could train health promoters who have very little formal training in health to be able to do a better job at navigating and guiding our cancer patients and our women towards breast health, and also in breast clinical exams. We've trained about 16,000 primary care providers, beginning with these promoters, with innovative materials that stepped completely out of what was the norm. We found when we looked at the materials that were there that they all looked like Barbie 25, Barbie with perky little white pink breasts, nothing that looked anything like the beautiful 40, 50, 30-year-old women that we were seeing in our communities in Mexico, brown, mostly larger, having breastfed for years. And so we needed to develop a new way of sharing what is beautiful about women and women's bodies in order to be able to educate our health promoters better. We were able to show, and this was work led by Dr. Nancy Keating from Harvard University, we published that in The Oncologist, that against what everyone had said, there was a significant increase in knowledge among health promoters, especially in clinical breast examination. Again, these are health promoters with almost no formal medical training or clinical training. We've gone on to extend that to try and adapt and adjust, and we're very interested in collaborating with these materials in different kinds of ways, and to be able to see how they can be used in other settings, including in the South Florida community, where we have so many migrants, documented and undocumented, who require a different kind of messaging around the hopeful way that we can cope with cancer. But another woman that we met along the way with a very, very different story than the one we had hoped we would see with Juanita was Doña Lucinda. And that's Dr. Julie Grelo, who I know is in the next room, who was with me at this point, not as my physician, but as a core collaborator leading globally so much advocacy around breast cancer and cancer overall. And we went in to see Doña Lucinda in a small hospital in Tepatitlan in Jalisco. And we were supposed to be seeing her because she was going to be able to get chemotherapy in a clinic, like we do dialysis, which is a huge innovation for the health system, so that women didn't have to travel. We walked in, and something was way off. And luckily, Julie was with me, because it turned out that Doña Lucinda had brain mets. Doña Lucinda was in her last days of life, and next to Doña Lucinda was her 17-year-old daughter, who had managed to get her to this hospital in a taxi. Doña Lucinda was very heavy, not easily moved, could not walk or move herself very well. And when we got there, and they thought they were doing chemo for a patient that can be cured, everything was fine. The minute they found out that she was palliative, the leader of the hospital said, she's got to get out of here. We've got to send her to the main hospital. We don't do palliative care here. She wasn't even in pain. She didn't require opioids. She required a kind of emotional support for herself and her daughter that our hospitals, or we had declared universal health coverage, were totally unable, because they chose to be, unable to provide any kind of care and support to this family. And so that was a truly rude awakening for me. I had written incredibly positive things about our health system, to find out that we had abandoned the cancer patients who were not going to survive because we wouldn't provide them with even the basics, and that they were the outcasts in our room, including in my rooms. In the rooms that I had where we had done advocacy, we only talked about cure. And the reality that I learned there is that survivorship is a much longer journey. And that led to what I think was very important work, a Lancet Commission report. Those of you may know the Lancet. The Lancet is our leading global medical journal, published weekly. This was a major report. I thank Doña Lucinda. I thank these two women that I met at our National Cancer Institute, because we were able to show that there is a tremendous lack of access to palliative care and pain relief, and that we are separating off these patients rather than thinking about a survivorship journey. There are a series of health system recommendations. They are not specific to breast cancer. They're not even specific to cancer. They talk about the reality of helping patients and their families and persons in a person-centered approach, in the co-creation of healthcare in a way that talks about rights and dignities throughout our lifetime. I also met Doña Rosa along the way. This is in Guadalajara, Jalisco. And Doña Rosa, there was also a very important meeting for us because my husband and President Frank had started the Seguro Popular at the time. And that Seguro Popular provided financial protection, health insurance coverage to many cancer patients, including, right about the time I was diagnosed, breast cancer went in. It was not the only cancer, it was one of the middle line cancers to go in for coverage. And so that meant that every woman in Mexico had the right to the same care that I received without having to pay a cent out of pocket. And we had patients coming in from the United States who were not covered here, who were covered in Mexico. So I go in to see Doña Lucinda, and she's got that huge smile on her face, and she's in a chemo session in Jalisco, and she tells me, this is my second round. And I thought, like, of the chemo. No, this is her second round of the cancer. So despite having been treated, her breast cancer had come back. And as we know, this is not a great message, but she had this huge smile on her face. And so I said, Doña Rosa, why are you so happy? And she held up her insurance card, and she said, the first time around, my kids lost their business. My family was driven into poverty. But this time, I'm the architect of my own treatment. I don't have to ask for anything. I'm here. I have insurance. It's being covered. And whatever happens, I don't have to force my family into poverty. And so the lesson that Doña Rosa took forward, and actually in the other photograph, she was speaking at our International Breast Cancer Conference about a year later in Mexico City, was that the right to health insurance, including full coverage for our cancers, is essential. And how much of a difference it makes, not only to the cancer itself and the possibility of living better through that cancer journey, but also to the way we feel about ourselves. Now, I'll take it to the end of, well, what do we want to do about this if we're thinking about the Doña Rosas and the Doña Lucindas and all the others? And as many of you know, the data that we have on cancer overall, particularly certain cancers, including breast cancer, is that in countries like the United States and Canada, thanks to more awareness, better science, and more access, we have this incredible drop in mortality rates. Huge. It's about a 40% decline, and my calculations suggest that thinking only of breast cancer, we're talking about having saved about 500,000 lives over the last 3 decades. The question is, what happens in our low and middle income countries? And so I've got there on that slide Mexico, Brazil, Costa Rica, and Colombia, and the trends are looking at what might happen in Mexico. And there's a choice to be made, because in Mexico, actually, they have shut down that program. So the rights that I was promoting and guaranteeing to so many women to cover their cancer are not in place right now. We've gone backwards in so many ways. But with the science that's available, what we know today, the question is, are these countries going to go the upward route with increasing mortality, which means that they will cross over in the next 5 or 10 years, and you'll have higher age-adjusted mortality rates for breast cancer and probably for many others in Latin America, for example, than in Canada or the United States? Or are they going to take advantage of the science and the capacity to do something using better access to health insurance and better access overall, which requires the kind of advocacy that we can do? Because yes, it's a supply side issue, but it's also a demand side issue. People have to know that they can fight for their rights, and that if they do, they're going to get access to care. And see if we can get a downward trend going that would follow the downward swing that we're seeing in mortality rates in high-income countries around the world. We've done a lot of pulling this work together in our very recent Lancet Breast Cancer Commission that was led by Dr. Charlotte Coles and a huge group of researchers. It was just published 3 weeks ago now, on April 16th. I encourage you to have a look at that because of so much of what it says, not only about breast cancer, but about all that we can do in terms of advocacy and communication around cancer and overall, and all the ways that cancer can actually empower people with cancer, with other issues, with family members with other health issues, but how cancer can become a kind of capital to empower many to do so much more, to have person-centered health systems. And this is the very last slide, and that is Mariana again. And I share this one because in the sorts of places that I work, with the communities where I work, the poverty is deep, and it's painful, and it's cruel. And when you add a cancer diagnosis onto that, it's very difficult to retain hope. And when you do the kind of research I do and where I do it, it's hard to insist that there is hope, there can be hope, and that guaranteeing access to cancer care and control should, can, and could be done. And this is this last story. So I always turn to this story because it's one that didn't have to end this way. Most of us, when we have cancer, we know we will have time with our families. Maybe short, maybe long, but we will have time to talk to them, time to share with them, and time to say goodbye. But I went septic, I got blood poisoning, somehow on my very last infusion, which is, just the luck of someone who's married to a physician, right? So I went septic that night. I was very, very ill, and I barely said goodbye to you, barely. And I got to the hospital, and thanks to divine intervention and access to amazing care, a couple of days later, I was much better, minus my port, and we were able to take a trip to Canada. And I told you that it was hard to deal with the bald mother, always, and what it meant, except that a week later we were in a butterfly farm in Canada. And the butterflies would not stop sitting on my turquoise hat. And we took that picture because I became the focus of Mariana's attention, because I was the focus for all of those butterflies, despite the illness, the baldness, the surgery, and all that it had done to me only a few days before. So it's our story of hope, even in times that can seem so dire, and that's the sort of hope that we need to project in order to ensure that globally and through what we do on cancer, we can ensure more access to all in a way that will not only not impoverish them, but can help to, I believe, end poverty and inequity in our world. Thank you very much.